Welcome. I am Luba Djurjanovic, and I have the pleasure to launch this telegenetics conversation. So on behalf of the New York Mid-Atlantic Consortium for Genetic and Newborn Screening Services, staff, Dr. Michelle Kajana, Dr. Joanna Bordurtha, Beth Bogle, Kunal Sanghavi, and Alyssa Terry and I from the Farah Institute, we thank you for your interest and participation today. Today's conference call webinar aims to bring together telegenetics providers and services in our region for us to learn from each other and identify ways to enhance our telegenetics practice. We will begin with a slide presentation by Alyssa Terry, and we will have enough time for discussion. Alyssa?
Okay. Hi, everyone. Thank you for joining us for this introduction to the NYMAC Telegenetics Community of Practice. My name is Alyssa Terry. I'm a genetic counselor at the Farah Institute in Binghamton. I'm joined today by my colleague, Luba, as well as several members of the NYMAC team. Oh. Kunal, can you help me with the slide?
Sure.
Okay. If you give me control back, I'll take it from there. So for those of you who aren't familiar, I wanted to introduce you to NYMAC. NYMAC, or the New York Mid-Atlantic Consortium for Genetic and Newborn Screening Services, was established in 2004 as one of 7 regional collaboratives in the country funded by the federal government. The NYMAC region includes Delaware, DC, Maryland, New Jersey, New York, Pennsylvania, Virginia, and West Virginia. And individuals in our region with genetic disease and their families, advocates, healthcare professionals, and public health professionals collaborate to ensure that individuals with heritable disorders have access to quality care and appropriate genetic expertise. And right now, one of the tools NYMAC hopes to support to improve access is telegenetics. Kunal, can you try to give me control back? Thanks. So in recent months, NYMAC wanted to better understand the current landscape and needs of telegenetics providers in the region. So we started with a general inquiry to genetics providers about who was doing telegenetics and or was interested in learning about it. Then a follow-up survey questionnaire was distributed to learn more about existing services. And a small survey was distributed to learn more about the educational needs of those interested in telegenetics. And preliminary results of these surveys are coming in a few moments. Kunal, I'm still not able to change the slide. Can you give me the control?
You should be able to change, Alicia. Let's try one more time.
Okay. So before we get going, I want to get us all on the same page by reviewing what is the telegenetics community of practice. So NYMAC wanted to support telegenetics in the region by providing a structure to bring together people interested in telegenetics to learn from each other. And the telegenetics community of practice aims to be a group of providers who are practicing, have experience with, or are interested in telegenetics, who will meet periodically via webinar or conference call to discuss their experience and strategies for successful use. The structure and topics for the TCOP webinars will be shaped by the survey information we have, as well as member preferences. And today, polls will be taken to gather member input. So we wanted to get a better sense of who was on the call today with a quick poll. And we want to ask you, are you currently providing telegenetic services? So Kunal's going to put that up for us. And you can respond right here live.
Almost 90% voted.
Okay.
A few more seconds.
Okay, so it looks like we have a fair number of people who are doing it, some who are not, and a fraction who are planning to do so, which is similar to what we've been experiencing in our group so far. Okay, Kunal, you can take us back to the slides.
You have the control, Lisa.
So our plan for today is to review the preliminary data from the NYMAC Telegenetics Landscape Survey, to discuss the interest that was expressed in various topics for our discussion. We want to have an open discussion about the survey data and also assess input from you about the plan for the TCOP. So as I said, our first goal had been just to find out who is doing telegenetics in our region. We utilized the NSGC member directory, the ACMG web locator, the NSGC listserv, a NYMAC news email, and state genetic counselor groups to identify facilities that provide any type of genetic services in the NYMAC region. Using this list, we made phone calls, emails, and postings to ask people whether or not they were doing any telegenetics. We had identified 179 unique genetics facilities, many of who have more than one genetic specialty group. So one center may have prenatal, pediatrics, cancer, adults. And we received a yes or no response about telegenetics from 80% of these 179 facilities. I don't seem to have control. Kunal, can you pass it? Thank you. Okay, change the slide, please. So if we look by state, we found the most genetics facilities in New York and the fewest in Delaware and West Virginia. 28% of institutions who responded were doing some form of telegenetics within the institution. Several facilities have more than one telegenetics program. They might have prenatal and pediatrics, for example. And just a note that national labs, national telegenetics businesses, and telegenetics groups based in other parts of the country are not included here, even though many of them do reach patients in the NYMAC region, and some of these groups are included in the survey to come. Next slide. So based on how many telegenetics groups we found, NYMAC was intrigued to know not just who, but also what, when, where, why, and how. We thought about whether we should call and talk to everyone, but decided it may be most useful to have numerical representation of what we learned that could be published in aggregate. So the NYMAC Telegenetics Landscape Survey was designed and approved by the IRB. Survey invitations were distributed to all providers who had indicated in that initial inquiry that they were doing telegenetics, as well as through the NSGC listserv, NYMAC News, and also a paper mailing to ACMG members. As a separate measure, an additional short topic survey was sent to all providers who expressed interest in telegenetics but were not yet doing it. Next slide. So overall, 52 out of the 63 facilities responded. This telegenetics group now includes national labs, national telegenetics businesses, and a few telegenetics services based outside of the NYMAC region. 88% of respondents were genetic counselors, 8% geneticists, and 4% other doctors and providers. 74% of reported services were active, 12% were planning, and 6% were no longer active. And we had invited people in all of these phases of programming to respond. Next slide. When we looked at what types of patients were receiving services, we saw that many groups offer multiple specialties. About 50% of programs did some prenatal, about 50% did some cancer, and closer to 30% offer pediatrics or adults. There was quite a variety of other specialties also. Next slide. Most programs offer multiple types of appointments with no obvious bias toward new results or follow-up, which was interesting as we've sometimes heard of more follow-up being done over telegenetics. A fair percent also offered some consults with other non-genetic specialists. Next slide. Respondents came from a variety of settings, a little over half from traditional medical institutions, 15% from laboratories, 8% from independent nonprofits, 10% from independent telegenetics businesses, and 12% from other groups, including HMOs, military hospitals, LLCs, lab referrals, and a nonprofit within a university. Next slide. There was a fair amount of experience among the respondents. 70% had been around for a year or more. 16% are in the first year, and 14% were in the planning stages. Next slide. With regard to technology, about 75% use some form of live video, the program video being the most common type, about 17%. 47% of programs offer at least some services by phone. About 12% of programs are using instruments for physical exam over telegenetics. Next slide. When we looked at where patients and providers were located, we see a cluster of programs with many, and some even saying unlimited, patient locations, probably their own home. And then a cluster with 1 to 5 sites, which are probably institution-to-institution connections. For the provider sites, almost 60% had only 1 to 4 sites for the genetics provider, and then a sizable group with many sites, again, these probably being genetics providers in home offices. Next slide. About half of programs reported providing some services to patients at home. For these home-based services, 55% use tablets or computers, and 45% use phones. So there's a lot of video going on, even with home consults. Next slide. One of the reasons people look to telemedicine is to reduce wait time. Here, 74% of active programs had a wait of 1 month or less. Among programs with an in-person alternative, about half said that the wait time was the same, and 30% said it was shorter. It was rare for programs to say that the telegenetic wait was longer, but we have heard anecdotally that this does happen because telegenetics becomes popular with patients. Next slide. Programs had a variety of strategies for using the EMR. Of the 37 programs that knew, 8% do not use the EMR at either site. 30% have both sites on the same EMR. Many commented that consult notes get sent to the referring provider and then make it put into their EMR. And another about 15% use the genetics provider EMR only. Next slide. When we look at staff, most programs, about 90% had a genetic counselor, 41% had a geneticist, and 53% had other healthcare providers involved. Some programs involved IT staff and telegenetic service coordinators, and in terms of training, about 65% reported that their staff had training to use telegenetics. Next slide. With regard to clinic volume, we saw about an equal number of clinics with a very low volume of 0 to 5 patients per month, as very high volume clinics of over 50 patients a month. And these are obviously very different program models. Next slide. Understanding how telegenetics programs expand access was a huge priority of this project. Only 6% of respondents said they do not feel their telegenetics program increases access to patients who would otherwise not have services. And among programs with a comparable in-person service, 55% felt the geographic reach of telegenetics was larger, where 21% did not feel it was larger. Most of these programs reported a large geographic reach, usually over 200 miles. Next. Among programs that knew about their billing process, only 35% said they bill insurance at either site. 19% bill patients directly, 21% are paid by the referring institution, and surprisingly, 21% say their telegenetic service is free. We even saw a few comments that the staff hours it took to do the billing was not worth the money that was being collected. Next. As we saw on the last slide, some programs get money from the referring provider. Here, 18% of programs reported contracts with other institutions to pay for services. Several other sources of funding were reported, including a variety of grants, individual donors, and lab contracts. Next. We explored perceptions of the cost of telegenetics to the institution. Among those who had an opinion, about half thought their institution saved money using telegenetics compared to in-person services. And 61% thought there was a mid-size or large setup cost to the institution to start the program. Again, this is just a provider's perception, not an actual financial analysis, but we do often hear from programs that the financial savings is usually on the patient side. Next. Ordering testing for distant patients can be more complicated. Slightly more programs have the telegenetics provider order testing than the distant provider. About 10% say that they collaborate. Institutional billing can also be tricky. Among those who knew, about 32% use institutional billing with telegenetics. Next. With regard to coordinating care, while the responsibility of making referrals seems evenly shared, care coordination is more often in the hands of the distant or referring provider. Next. Evaluation is another area of importance in genetics and is a priority to NYMAC. 81% of respondents either collect no data or were unsure. Among the few programs that do collect data, that on patient satisfaction and experience was most common, as it also has been most common in a lot of previous telegenetics research. Next. Among the 43% of programs that have provided services in other states, licensure appears to be a much bigger issue than credentialing or billing. There were many comments throughout the survey about the expense and inconvenience of having multiple licenses. Next. We asked respondents some open-ended questions about what they perceive the benefits of telegenetics to be for providers and for patients. When asked about provider benefits, most respondents still focused on patient access and convenience. Other benefits cited were less provider travel, working remotely, and flexible hours. When asked about patient benefits, respondents focused on patient convenience and reduced travel, and shorter and more flexible scheduling. Again, people pointed to access, lower cost, and provision of otherwise unavailable services, among other things. Next. Among the 27 people who cited barriers, the most commonly cited barrier was licensure. Also mentioned was engaging referring providers, financial issues, patient interest and preferences, institutional and technology. Next. Along the same lines, 29 people cited challenges. The most commonly cited challenge was ensuring a good patient experience without the face-to-face relationship. Many providers expressed that they were still getting used to not seeing the patient in person. Other challenges were technical issues, billing and finance, ordering testing, medical records, engagement of the distant provider, licensure and logs, getting too many referrals, and concern about whether follow-up happens, among others. Next. In another open-ended question, 26 people cited successes. The most commonly cited success was improved access, which is important to NYMAC. Patient satisfaction and convenience was again pointed out. Technology success was helpful to some programs. Some programs were proud to be addressing unique clinical scenarios. Reduced costs to the patient and improved clinical outcomes were also noted as successes. "23 respondents shared a vision for the future of their program. The most commonly cited vision was for expansion. Programs also plan to do more billing, use more video, provide services to patients at home, and obtain more state licenses. So really, bigger and more was the theme." Go ahead. The telegenetics providers rated their interest in the topics for the TCOP. Care coordination was rated number 1, reaching the underserved as number 2, and funding strategies for number 3. Some of the non-listed topics that were suggested include liability, record keeping, and independent practitioners. Next slide. Next slide. So we compare the previous slide to this one. Go back one, please. So here we looked at 23 people who were interested in telegenetics, and they were asked the same question. Of these respondents, 87% are in medical institutions. There were 15 genetic counselors, 4 other healthcare providers, and 2 geneticists. So this group rated funding strategies as number 1, business planning as number 2, and technology options as number 3. So these people were much more focused on the most basic aspects of setting up a program, paying for it, and getting the needed technology. Next slide. So when we looked at all of that, what stood out to NYMAC? Well, we were surprised by the overall prevalence. 23% of all the genetics groups we identified responded that they do some telegenetics, and it was 28% among responders. This project ended up finding 62 telegenetics programs in our region. A lot of patients are being served in their own homes. About 50% of respondents offer home-based services, 55% of which use video. Right now, the wait time is still short. About 74% of active programs have a wait time of a month or less. Billing is still complicated, and only 35% of programs reported billing insurance. Right now, little data is being gathered, and it's mostly about patient satisfaction and experience, which leaves a lot of room for growth and improvement in terms of evaluation. Not surprisingly, but good to confirm, the most common positive cited was patient access and convenience, and most programs plan to expand in the future. Next. We also felt that the data suggests that we stand to learn a lot from each other. There's a wealth of experience in this group. 70% of programs have been around for more than a year. And there was also a lot of diversity in funding, logistics, and technology, which is great in terms of discussing and exploring alternatives. When we looked at the expressed topic preferences, we saw that those already doing telegenetics rated care coordination, reaching the underserved, and funding highest, whereas those who are interested rated funding, business planning, and technology highest. And we really found these ratings consistent with extending versus launching a telegenetics program. Next slide. So now, after sort of walking you through our preliminary findings, we'd love to sort of take a few minutes and discuss what stands out to you about these findings. On your screen, you should have a button that allows you to raise your hand if there is anything that you would like to share or discuss with us.
David, unmuted.
Can you hear me?
Yeah.
Okay, good. I may have missed it. How did you define telemedicine in the survey?
Initially, when we asked people, you know, in the initial inquiry, we just asked them whether or not they were doing it, yes or no. And then within the survey itself, we asked what type of technology they're using, so we know which respondents are using live video, who's using, you know, store and forward, who's just using phone. So, you know, we have the ability within the data to look at those different groups. I know different people use different definitions. We wanted to be inclusive, as I know the NCC survey that was done a few years ago included people that were doing phone-based services, so I think we wanted to sort of mirror that, but we do have the ability to look at the data different ways.
I would recommend eliminating telephone genetic services because that's not telemedicine, and it's not going to be something that, I'm not sure how to put it, but I would say that lots of people do genetics on the telephone, but that's not telemedicine. And if you want to actually demonstrate, you know, what's going on, it'd be good to analyze the people who are doing video in some fashion rather than people who are just relying on telephones.
Yeah, I know. I mean, I know that's often a topic of discussion, and a lot of people have gone back and forth about it. We did sort of look back at the NCC survey to make that decision, and you know, we did want within the data to have the ability to separate those groups out. So.
Right. Well, I mean, the American Telemedicine Association definition of telemedicine just is live interactive video or store and forward, you know, video. So it's not telephone. And it's sort of, especially if people are responding to a survey, they very well may call somebody and give them the results of their lab tests over the phone, but that's not really telegenetic services. And so I think we want to encourage people just to do, high quality telemedicine that actually is equivalent to seeing patients in person. And that's the ultimate goal. And I think, surveying people, breaking out the information about who's doing it by live interactive or stored forward video is a good place to start. Because otherwise, it looks like lots of people are doing telegenetics, and that's really not quite what we would call telegenetics, I think. That's my opinion.
Yeah, I mean, I totally hear what you're saying. I do think, though, that there's a difference between saying someone calls with results and someone spending an hour to an hour and a half on the phone with somebody explaining something. So I do think there are levels of phone consultation to think about. I think that's something that it looks like, to me, it's evolving over time. I was surprised by the number of home-based services that are using video now. I think that that's only, increasing more and more over time.
Good. I put my hand down.
Thank you, David. There's a comment, Alisa, stating that telephone services, and that's maybe a first step for someone to move towards telegenetics, and that's from Luba. I see a lot of potential in the TCOP to brainstorm and learn from each other, as Alicia, you rightly pointed out. There are a couple of questions. So one of them is, do you plan to look more into issues with genetic counseling licensure by state? And a supplementary is, are most GCs getting licensed in all states that they provide telecounseling in?
It is my impression, yes, that genetic counselors are getting licensed in states that they are contacting patients in. There are some states, I know, I believe it's New Jersey, where you're allowed to work with a certain number of patients a year without a license. So it depends on the particular licensure in that state. And there are a number of states in the NYMAC region that still do not have genetic counseling licensure. So there's a huge variety in what the rules are. And I certainly think that the people that are, going into this certainly have to be aware as they expand their services to other states what the licensure rules are. And I think, I think it would be a good thing for NYMAC to, within the TCOP, maybe have people better understand, provide some sort of summary of what the genetic counseling licensure laws are and how that would affect a telegenetics practice.
Right. Along the same lines, two more comments, Alisa. I agree that telegenetics is no simply explaining a set result. I think a formal definition of telegenetics would be helpful. And our very own NYMAC co-director mentions that I think this will also give us a group with which to expand to for telemedicine. I see no more hands raised on this topic, Lisa.
Okay, great. All right, so let's move to the next slide. So before we finish today, we wanted to get your help in making a plan for the future of the telegenetics community of practice. So just as Kunal helped us with that poll in the beginning, we're going to take a few more polls to really understand the needs of the group better and shape what we are going to set the agenda to be in the coming meetings. So our first question to the group is, do you feel a need to have better communication among telegenetics providers?
%70 voted. 5 more seconds. Okay.
Okay, so it looks like close to 70% feel yes. Nobody says no, and 30% of people are still unsure how this is going to work out. So good, that's helpful. Our second question was, are there resources that you feel could be provided to support telegenetics programs? So I'm sort of thinking about how one of the last commenters asked about more information about genetic counseling law. So are there other resources like that that you think NYMAC could help people with that would help telegenetics?
Almost 80% voted. Five more seconds.
Okay, great. Similar numbers to last time. Okay. So the next question is sort of important to how we're planning on structuring things. So our vision for this was to have one or two providers with experience share their ideas on a given topic at the beginning of a call, and then open it up to discussion and questions from everyone else. So sort of with that possibility in mind, we wanted to know if you prefer strictly informational webinars where the presenter talks the whole time, totally open discussion, or a combination of the two.
Five more seconds.
Okay, good. So it looks like most people are sort of on the same page. We are some hybrid of expertise and then conversation. So I think that's probably the direction we'll start with. One other question we wanted to ask was, how frequently do people think we should meet? So, you know, these types of groups have all different types of schedules, and we wanted to get some input about how often you think these calls would be useful. Okay. Okay. I'm making notes of all these. Okay. And our last live poll question. So our sort of vision going into this was to use the survey questions that we asked everyone about topics of interest to shape the agenda for the next several calls. If we look at the two groups together, the overall top area of interest was funding strategies. So we just wanted to kind of put that out there, see what people thought about starting with funding strategies as the next call. Okay. Okay. So with regard to any other inputs or overall thoughts on today's webinar, there will be a post-webinar question that will get emailed out that will allow you to share kind of broader thoughts about how today went and other things you'd like to see. So we really thank you for sharing your thoughts with us. It's really useful. Go ahead to the next slide, Kunal. So in looking ahead, our plan for the TCOP so far is to have, this series of interactive webinars shaped by your feedback. We will be sending out an email with a proposed schedule and topics, and we may reach out to certain people within the group who have expertise on certain topics to lead a discussion. And then we also see this interactive community forming within NYMAC system called Basecamp. And this would be a place that you can subscribe to, sort of an online community where the slides from the webinars will be shared and probably sort of notes about what happened during each webinar. That's where we would be posting any resources for telegenetics that people have come up with, things that would be helpful to programs. You as members would also have the ability to start discussions with other members of the TCOP. So if you have questions about certain technologies or certain funding strategies and want to reach out to other people and ask, that would be a way to do it. So we will be sending out emails to people shortly to join that, that group. Next slide. So with that, we want to thank all of you so much for your time. If you have any questions, Beth and Kunal's emails are here from NYMAC, and NYMAC really looks forward to all of us working together on this collaborative effort.
Thanks, Alicia, for a wonderful overview of our efforts. Some housekeeping items. The post-webinar survey, it's a very brief questionnaire with 5 to 6 questions, will be accessible right after the webinar concludes. So we welcome your feedback and additional thoughts. We have some time should you have any questions for any one of us before we conclude today. You are welcome to type your questions in the question box that you can see in the toolbox, or raise your hand and we can unmute you.
Kunal, this is Beth. While we're waiting for people to think about some questions, I just thought I would throw out there that in Basecamp, you'll see that there's an option to start a discussion. So I think that we saw just over half of people who were interested in the first call being about funding, but also a significant amount who weren't interested in that as the first call. So what we can do is actually have our first Basecamp discussion be about what other topics people would prioritize for those that did not agree with having funding as the first discussion. And that will be really helpful for us in coming up with the agenda for the ongoing TCOP calls.
Great.
We have a question. Will the results of the NYMAC survey become public?
So we will be sharing the survey information at the upcoming NYMAC Summit, which is coming up, and then there is consideration being given to publishing the information, obviously in aggregate form as it was discussed today. So nothing completely concrete yet, but possibly yes.
One suggestion for online discussion is, how about a listserv for email communications with the group?
So Basecamp actually has a very similar functionality to that, where if anybody posts a message in Basecamp, an email will go out to anybody who is part of the group. And you can choose, just like a listserv, to receive those updates as a digest so that you don't get an email every single time, or you can receive individual emails. So essentially, the Basecamp can be used like a listserv, just organizing our discussions by topic and allowing us to also share documents. So I think that we'd like to start with trying Basecamp out, and then if people feel like it's not serving our needs, then we could look into whether a listserv would be better. I think maybe on the next call that we could do a quick poll and get feedback of whether people think that Basecamp is working. Just on a side note too, just to help get that off the ground, you'll get an email invitation and it'll be from Basecamp. It won't be from any of us, and so just keep an eye out for that. And you'll have to create an account, but it's a free account and it doesn't cost anything to do that, and that will sign you up for participating in the group.
Great, thanks, Beth. One more question. If we haven't had time to fill out the survey yet, do you still want them?
Yes.
Yes, please.
Yes, that would be great. Okay, how about a buddy or mentoring system to pair me up with someone so I can ask questions and get support?
Good idea. Yeah, that makes a lot of sense. I'm writing these things down. These are all things that we can sort of look at, and by the time we get back together again, we should have some more thoughts about it, but that's a great idea.
Alisa, we can access these questions and comments after the webinar.
Great.
One more comment. For my department, we are very short of time to get started. Once we start, I anticipate a flood of questions within a short time frame. So I guess we would be happy to help in whatever capacity we can in terms of addressing those questions.
Mm-hmm.
Okay, I don't see any additional raised hands or questions. Any final thoughts, Alisa, before we conclude today?
I guess I just want people to know sort of what to expect. So you will get from us, as Beth said, the Basecamp invitation. We will also be working internally on setting an agenda and a schedule for upcoming calls. So eventually you'll get that. I mean, that may be delayed a little bit because we're looking for some feedback on what people want to hear about and see. And then certain people may also get requests from us for leading a discussion on certain topics. So there'll be, several communications coming out in addition to the post-webinar questions, and we can hope to continue to, get your input on how to shape this and communicate back and forth about how it's going to move forward.
All right. Beth, any housekeeping items before we conclude?
No, just thank you to Alyssa and Luba. We've had a great collaboration with the FAIR Institute working on this survey and getting to this point. So, and thank you to everyone for taking time to complete the survey and joining today's call.
Thanks, Pat. And we would also like to acknowledge the guidance and support and help that we've received from our national experts as well, particularly Dr. David Sannery, who has helped us with our telegenetics efforts. So we seek your continued participation, and thank you once again for your time today. This concludes our webinar. Thank you all.
Thank you.